Okay. Thank you very much, and good afternoon to everybody. And I'm sure you are all tired by now, so I will try my best. And it's a pleasure to be at this conference, and I express my gratitude to you, Professor Artemi Tsitsika, for inviting me to this. So I declare no financial, personal, research conflicts of interest. So one of the questions we are facing today is youth mental health in crisis, because that's what we talk in newspapers everywhere. So in recent years, mental health of adolescents and young adults has become a critical issue globally, and Greece is no exception. Childhood adolescent mental health is a global priority, as the consequences of untreated mental health issues in children and adolescents can be severe and affecting not only their current well-being, but also their future prospects. And that's the important thing. The WHO supports development and implementation of multi-sectoral, evidence-informed and human rights-based strategies for the promotion of mental health, prevention of mental health conditions, provision of mental health care for children, adolescents, and their families. And I will again underline what they say, evidence-informed or evidence-based strategies, because we don't evaluate those strategies very often. So why focus on Generation Z? This is the generation, those born between mid-90s and early 2010s. I think I wanted to focus on them because they face unique challenges that significantly impact their mental health. And maybe because my son is of that age. So I wanted to understand this generation better because we have clashes. They are extremely diverse in terms of demographics, racially, linguistically, culturally, and socioeconomically. And this is not only in the US, this is also here in Greece. And they have many influences on their mental health beyond the generation in which they were born. They value diversity and inclusivity, and often they advocate for social justice and equality. They are digital natives, so this is the generation to grow up entirely within the world of Web 2, social media, digital platforms, etc. And they have never known the world without the internet and spend much of the time on this. And if we think maybe those who are older, who are 26 today, maybe they had preserved their preschool years, but the younger generation, the younger people in this generation, they are today 14 to 15 years old. Also, they are a generation of constant crisis. We have heard this also because really their identities have been formed amid continuous crisis. If we think they were adolescent, identities formed then. And the crisis, whether it's economic, refugee, COVID-19, or climate crisis. Now, the recent CDC data indicate that among high school students, 29% experience poor mental health, 42% have persistent feelings of sadness or hopelessness, 22 have considered suicide, which is it is a high proportion. 18% have made a suicide plan, and 10% have attempted suicide. So in order to understand the Greek youth, we really need, and the psychological and social challenges they face today, we really need to understand by what factors, which factors had contributed to their experience and to the way, to the challenges they experience today. So first is financial crisis, 10 years. So these are the 26-year-old today. and economic instability. I just want to give one figure that the unemployment rate picked up in 2013 to 30%. And we are talking about parents, those youngsters who are living with their families. So many, their families, their parents face reduced wages, they had job losses, etc. And at that time, we had also deteriorating public health services. So this economic instability, which goes on still, shatters the belief of young people that hard work and education guarantees stable employment and a secure future. Of course, it's not for everybody, but for many, and especially those who are from medium to low socioeconomic status. They also feel that they lack direction in their life, and all this sort of increase their feelings of frustration, hopelessness, etc. Then we had migration crisis. You remember this from 2016 onwards, big influx of refugees. Then pandemic. I'm not going to talk about the pandemic and those long lockdowns and how it impacted on mental health. The Tebi train accident, then migration mobility, it goes like that. So many young Greeks have been forced to migrate in search of better opportunities. And they are the sort of role model for the younger ones. And what's happening, and it's crazy, I think, is that we have this brain drain, but we parents are very often very proud that our child got a job abroad, or that they succeeded, or they study abroad. So we are very proud of this, and also our politicians. So we had then exposure to natural disasters, floods, wildfires, which are maybe climate-related change. It's not all climate, and we know about it. And then the Tembi train. That caused at least 57 people were killed at this train accident, and more than 80 others were injured. Most were young people under 26, students. So that created, of course, a big upheaval and huge feelings of rage and hopelessness and mistrust in institutions. The government's decision to establish university police force, wars in Ukraine and Gaza, and we live in a place where we feel, young people do feel very, it's the geopolitical place of Greece, which makes us feel insecure that maybe there will be war again. And I'm not going to talk about school. I want it about education. I mean, Greeks know what I mean by this. All this preparation for Pan-Hellenic exams. It's a very traumatic period for our young, late adolescents. They're between 15 and 19, because they have to study all day and they have to attend to parallel schools. The cram schools, which is private tuition, and the day school. So all day they are. So they don't have the time to sleep. They don't have the time to exercise. And we know that all that is related with a good mental health. So despite many educational reforms which have been done here in Greece since 2000, very few changes really happened, and more of the reforms are about how are they going to enter the tertiary education. So there hasn't been anything to support, for example, vocational education. So there is this, and if we want to see the peak of suicide attempts, we do see them around when the results are announced in the newspaper, in the television. I don't know whether you remember, but in the past, the results were announced in newspapers, so everybody could see it. what what is important to say is that one moment, I've got that actually 1 in 3 students, this from studies, from a study, report highly stressed by schoolwork pressure. Also, Greek adolescents report low satisfaction with school, specifically the 15-year-olds. And they are the bottom in the globally, if you compare them with other European countries. So I'm not going to talk now about this. You see, we with the unemployment rate, it's going better, but you see, these are the results. What? Okay. These are the data from 2019. And you can see that the youth unemployment is very high in the ages 15 to 24. Also, child poverty is above the EU average. And if you see the percentage of population at risk for poverty or social exclusion, this is also higher in Greece as compared to EU average in 2022. Okay. We are hearing about rising youth violence in Greece. I mean, this is in the newspapers sort of every day. There are many explanations for this. Is mix and match ideologies that justify rage and anti-system view, is loss of trust in institution, sense of heightened dystopia, lack of support systems, and the pandemic and subsequent lockdowns. And now a new legislation is going to be passed through, but we don't see any rehabilitation programs in this. It's really what they are talking about is that it will be much easier to send young people to jail from the age of 14. So this is not going to solve really the problem. What is worrying is that still this is the study which was done, it's a European study, pan-European study, and this was published in 2022. So I think it's worrying to say that 77% of young Greeks are ready to emigrate abroad in search of work. They want to leave the country. 45% say that definitely they want. The other ones, yes, maybe. If you look at the top concerns for Greek Gen Zers is cost of living, unemployment, and look at this, crime and personal safety, which didn't come in the global Zers. 46% say that, okay, the overall mental well-being is good or extremely good. It's a lower percentage than from the global sense. And but what we have seen from that study is that Greeks are the most stressed and anxious most of the time, 63% as opposed to 46%. This is another study which is done by the university, and it is health behavior and in school-based children, and this is within a WHO actually initiative. So all the European countries are also in this study, so that allows us to compare different things. So, for example, we don't have as much drug use as other countries, as other European countries. We are below the average, but we are above average for gambling. So these are the things that one needs to be aware of. And only sort of 37.4% of boys and lower, under 30% of girls, they state that they are satisfied overall with their life, which is small. So it's not a happy generation. Now, turning a little bit to youth mental health in Greece, I'm not going to stay long on this, but what I want to say is that really we don't have epidemiological data in this country. We don't have one epidemiological study. We don't have one cohort study to have a look at and to be able to look at risk factors, proper epidemiological study. So if you look, there are many studies, and they may be, for Ioannina, for Crete, etc., but it's not really well organized. So if you look at all papers, you can deduct that probably 20% of adolescents in Greece are estimated to experience mental health difficulties, not disorder, because this is all based on self-reports. So I sometimes think that all these figures that they give, 60%, 40%, are probably very high, because these are cross-sectional studies and then pinpoint, and they are using cutoff scores. So there's no clinical diagnosis and not taking into account the level of functioning of those children. PTSD is particularly prevalent among refugees, especially unaccompanied refugees and migrant youth who have experienced significant trauma. And look at the suicide attempts and suicide. These are maybe, suicide attempts, suicidal thoughts are high, but actually deaths by suicide are still very low in Greece in comparison to other countries. The other important is to say that only about 30% access mental health with mental health issues receive the necessary treatment. So most are go untreated. And I'm talking about those who are in need of treatment, not those who just feel sad and don't feel very well, etc. There is notable disparity in access of mental health services between urban and rural areas. And about stigma and awareness, because we do hear, it's stigmatizing and so on. Many Greek Gen Zers, they are open about their mental health. They talk to each other. They post things. However, they still face stigma when seeking help. Concerns about judgment or discrimination by employers or peers deter them from accessing support. And over 50% of young people are unaware of where to seek help. They don't know whether they can get. And during COVID, they were saying, my parents don't have money to pay for me to get help. So these are significant barriers. I'm leaving those. Just, you see, suicidal ideation throughout since 2003 onwards, we see that this is increasing. The suicide attempts, and the same for suicide, for the suicides. I leave this. This is from a qualitative study. I will read only just one. The future seems dark and completely uncertain. We are losing best years. Depression, anxiety about the future prevail. So it's very sort of doomy messages that adolescents. These are last year lyceum students in the high school who were preparing for their exam during COVID period. So, what are the challenges in optimizing mental health services for youth? First is resource allocation. Unequal distribution of mental health resources across Greece, but also within mental health. Children and adolescents, we all talk about, the need for prevention and the need for this, but we are the Cinderella. We are at the end. So the whole psychiatric reform really went for the institutionalization of the adult hospitals. Financial constraints. shortage of CAP, child adolescent psychiatrists in public sector, few posts filled. Nowadays, even if you advertise the post, nobody applies. The reason, because the wages are very low. And you cannot make up also with the working in the hospital in the afternoon where you get paid the 20 euros or something per patient, because for us to see a patient, we need 1 hour to understand, because we are not seeing just the young person. We need to see the family. We need to have the whole picture. Weak employment security in NGOs. This is important because there are some NGOs running those services, but they are paid on 3 months, their contracts are 3 monthly. So they are very insecure. That means they cannot actually invest also in their work. Sizable informal economy situated in a free market political system define an outdated and ultimately expensive and ineffective health system. Really investing in health, but in mental health, should be seen not as a cost, but as a priority social investment. Primary health, weak system. Primary health doesn't really exist. Maybe we can say it exists in the countryside. But if we think about Athens, it's very weak. We had many reforms and trying to do this, and it has failed until now. It has failed, maybe because, I don't know the reason, maybe it's again because of the pay. Doctors don't want to enter this system. I don't know. So, but if you don't have a primary healthcare system, then you cannot have integrated care. Telemental health. Okay, we do have telemental health services, and especially they have started since COVID-19, since the pandemic. But one needs to be very cautious about those, because they are, many professionals groups started doing different things, and private professionals, some of them are absolutely unsupervised, and they do not operate with a GPDR system. So, and the other thing which we know is that the Greeks, they do like, and that's what they reported. Okay, we can have telehealth services, but we would like the one-to-one contact also. Yeah. There is a weak stakeholder coordination. Understand what it means. So it's lots of activities, repetitive things, repetitions are made, and there is, it's like everybody's inventing the wheel. So very weak coordination. Mental health care leaders don't feel empowered at all because of the lack of the resources. They are burned out also, and they cannot actually plan. They've got ideas what they could do innovative, use innovative strategies or innovative services, but they don't have resources to do it. So I'll give you an example, like telemedicine was introduced by the Greek government, by the second regional authority, which was delivering telemedicine from Athens to all Aegean islands. Dr. Samelamanios, you were in Asclepio Voula, you are giving to also, yes, to some islands, and Tatikon was using to other islands. And this was working really well. But there is nobody now to run it. So at the same time, we were asking for the post to be advertised. For one NHS child psychiatry post to be advertised, was not advertised, but 10 pediatric posts were advertised. in a clinic which has many pediatricians. So this gives you the value of mental health. It's nice to talk about it in the newspapers and so on, but there is no investment in it. So what happened? This telemedicine service has been suspended because I couldn't do everything. Outpatient, liaison, and telemedicine service. So I thought that if I do this, they will do something, but they didn't. That means that they don't care. So then anyway. Stigma and awareness, I think, I'm not going to put, it's another challenge, but with this, we are getting, I think, better. There is a lot of awareness campaigns and people are more sensitized. And we've got still problem with training and capacity building. And when I'm talking about training, it's really to have well-evaluated programs for training on mental health issues for pediatricians who are in the primary health care, but also for mental health professionals like psychologists who could be in the front line of the service. Where is it going this? Okay, I'm leaving this. So what are the opportunities? Gen Z is increasingly open to holistic approaches that integrate physical, mental, and social health. This includes mindfulness practices, exercise, sleep hygiene, and nutrition. This is from studies from Meteron, from the social sciences, what they have been answering. So we could change some of the things. Leveraging social media. While social media can contribute to mental health challenges, it can also be a powerful tool for support. Platforms can be used, we know this, to spread awareness, provide resources, and so on. But what we need to be very cautious is about that these platforms are evidence-informed, because there is a lot of trash in the internet. What this generation lacks is, of course, flexibility. Offering flexible scheduling for appointments. They cannot wait for 5 weeks. If an adolescent decided he wants to talk to somebody, he wants to talk, and not wait for weeks and months. So walk-in availability, we don't have in our clinics. We could reorganize them, especially the community clinics. They are called community clinics, but actually what they do is do the same thing that hospitals do, that the outpatient. So I think things are not very well organized. Okay, to have, of course we don't have resources, but if we did, we could spare some of the resources. Greek Gen Zers are highly vocal about social issues. We have seen this after TB also. 93% are ranking emotional health as their priority. Nearly 76% regularly discuss it. And look at this, 80% trust healthcare staff for information. That's important. So they are trusting the healthcare. So encouraging youth participation, advocacy, peer support groups could help actually reduce stigma, foster a culture of openness. Then community-based care. I was thinking, for example, the Headscape centers, which are in the community in Australia. So they are not so stigmatizing. Jigsaw centers are in Ireland. In most of the country, Germany, Denmark, UK, they all have similar to Headspaces centers. Now, that doesn't mean that they will solve our problem. Because actually, what has happened after so many, they are working now, operating for many years. And in the last report that was commissioned by the Australian government about the outcomes of the Headspace, what they found was that 36% of young people who attended those services had significant improvement, but similar to that one if they didn't go. So this is with the spontaneous remission, okay? 51% didn't show any change, and 13% had significant worsening. So it's not that those centers are not good, but maybe they need to reevaluate also how they work. So what it seems to me is that those young people who have enduring and complex psychiatric problems, mental health problems, they are the ones and are need of therapy. They are the ones that they are not offered even by our NHS as it stands. The reason, because there are no beds, because in outpatient hospital, outpatient clinics, there is no referral pattern. So we may be seeing things that should be seen in the primary care setting. So there's no time to see those children who are highly disturbed. The one thing I wanted to say about psychologists and social workers in schools, it's important. 2 minutes, because it has been announced that the number of psychologists and social workers is going to be doubled in the schools. This is not going to solve the problem. Because they need to have a very clear role. They need to be supervised. They need to be linked in and interconnected with health services and other services. Yesterday you asked me whether I was going to talk about the school programs, universal, that some of them harm and so on. No, I'm not going to talk about it, but we do need to be aware that these programs that it's a fantasy also, that we will go make universal programs in the schools and kids will be okay. This is a fantasy. So we do need to have a target, a focus. What is this program about? It needs to be done with children, and it needs to incorporate teachers also. Going from outside, it's not going to help. So some kids, the studies are showing that some kids get worse, actually, after those programs. So I think what we need to learn as Greeks is to review the evidence and try develop our programs, pilot them with very good outcome measures. And if they work, then go and implement them. So I will finish here. I think this is just to show there is a example of collaborative effort, which is Stavros Niarchos and Child Adolescent Mind Health, Child Mind, this CAMI project, which is in collaboration, and you can find on the first report on their website, which is Understanding Priority Needs for Child Adolescent Mental Health Services and Landscape Analysis. It is to be seen what will work, what will not work, but I think this is the first effort that really tries to have also evaluation incorporated in it. On the other hand, you know, the Greek government has allocated funds from European Commission Recovery Resilience Facility to establish those 10 early intervention services for psychosis. So this is first year that it's run. We don't know what will be the outcome, but we know a bit of the outcome of the family and child day centers and mobile units. We don't know anything about them, basically. So no, we don't know what they've been doing. You know, they were operating for 14 months. Some of them closed because there is no funding more. And some others continue with 3 months contract. so people live. So it's important because this was a lot of money, and one could think how this money could be used much better. Thank you.